السلام عليكم. أنا رضا عبدالفتاح، طبيب أسنان ممارس بولاية فلوريدا الأمريكية. سوف أتكلم على محتويات المحاضرة التي سوف ألقيها في جامعة الأهرام الكندية ب6 أكتوبر بالجيزة يوم 3 من فبراير سنة 2019. The first point I'm going to be talking about is the structures and functions of the oral maxillofacial region, including the mouth, the jaws, and associated structures. For example, the occlusion, if it is imbalanced, it might cause many issues, dysfunctional and also pain. If the TMJ is dysfunctional with disc displacement or arthritic changes, will cause more pain in the oral and paraoral structures. If the tongue is retruded, encroaching on the oropharynx, causing narrowing of the upper airway, it will cause sleep disordered breathing that has more complication not only in the area of the oral maxillofacial region, but also in the entire body, including hypertension, cardiovascular disease, diabetes, and other unrelated or seemingly unrelated issues. The second point I will be discussing is the diagnosis. And all the time when I am lecturing and I'm telling my attendees, diagnosis, diagnosis, diagnosis. Diagnosis is the key for successful treatment. Without proper diagnosis, the treatment may be empirical, may be trial and error, and it is usually failing, unless you are lucky. Therefore, we are going to talk about the methods of differentiating the orofacial pain, localizing the orofacial pain, and determining what is the best treatment planning for this pain. The third point is going to be on the management of these pains. Which type of treatment that is suitable for which type of pain? Is the acute pain good for this treatment? Is it chronic pain that needs different kind of treatment? It is not one thing fits all. It's not one treatment will be for everything. Each diagnosis needs a specific treatment, and each specific diagnosis needs a specific treatment. Therefore, we are gonna explain different types of management. First of which will be oral appliances. Which oral appliance? Is it an upper? Is it a lower? Is it anterior? Is it posterior? Is it eccentric? One of these points should be adequate for one of the diagnoses. How about ultrasound? Can we utilize ultrasound for dental pain? Can we utilize it for pain coming in the orofacial region? How about electric stimulation? How about transcranial electrical stimulation? Do we use low-level laser therapy? Is it effective? What kind of therapy we should use? Do we use injections, intraoral, extraoral? Do we have a problem with getting a patient anesthetized even after using the proper anesthetic solution and the proper anesthetic technique? Do we have difficulty in getting those patients numb? We are going to address this issue. Now, do we use any kind of medications? Are the medications suitable for certain procedures? Are the medications suitable for certain patients? What are the contraindications for these medications? Am I going to use the anti-inflammatory medications for every patient? And how long I'm going to use it? Can I use an alternative of some kind of nutritional substance that they are available in your kitchen instead of the long-term, the non-steroidal anti-inflammatory? Now, how about the sleep and the sleep breathing condition of the patient, can it affect the treatment? Can it affect the success of treatment? If the patient does not have a good integration of an implant, if the patient is having post-operative pain after a root canal treatment, if the patient having a problem after perio-surgery, do we have a reason for that? Can we explain that? Do we have an explanation for the patient who is clenching and grinding his teeth at night? Would that affect my treatment success? All of these issues will be discussed in details within the permitted time. إن شاء الله سوف يكون يوم علمي جميل مفيد للجميع، وإن شاء الله نحاول إن احنا نستعمل هذه المعلومات لخدمة مرضانا إن شاء الله. شكرا على حسن الاستماع، ونشوفكم بخير إن شاء الله يوم 3 فبراير الساعة 10 تماما. والسلام عليكم ورحمة الله.